Alzheimer's disease casts a long and growing shadow across the globe. It slowly erodes memory and identity, placing immense emotional and financial burdens on families. As our population ages, the number affected is rising fast, yet a cure remains elusive. Now scientists are exploring a surprising candidate for prevention: lithium, a simple salt long used in mental health. Early evidence suggests lithium may protect the brain, opening a hopeful new chapter in the fight against Alzheimer's. Lithium has been a cornerstone of psychiatric medicine for over 70 years, transforming countless lives by stabilizing mood. Recently, researchers noticed that long-term lithium users seem to have a lower risk of dementia. Studies now show lithium may reduce harmful brain plaques and tangles linked to Alzheimer's. This old medicine could offer new hope in protecting memory and brain health for generations to come. Lithium is a soft, silvery white metal, one of nature's fundamental building blocks. Found in rocks and mineral springs, it's forged in the stars and scattered across Earth's crust. In 1949, psychiatrist John Kay discovered lithium's remarkable calming effect on mania. It became the first effective treatment for bipolar disorder, offering hope and stability. Lithium smooths out mood swings, restoring balance to the brain's chemistry. But it requires careful monitoring, a delicate balance that defines its use to this day. Scientists are now looking at lithium with fresh eyes, curious about its effects on the brain. Observations suggest patients taking lithium for mood disorders may have lower rates of dementia. Now, researchers are exploring if microdoses could protect the brain without the side effects of higher doses. This old medicine may become a new tool in the fight against Alzheimer's, shifting lithium from mood stabilizer to potential guardian of brain health. Alzheimer's disease begins its damage long before symptoms appear. At its core is a sticky protein fragment called amyloid-beta. In Alzheimer's, these fragments clump together, forming plaques that disrupt communication between brain cells. This toxic buildup triggers a cascade of damage, interfering with memory and function. Understanding and stopping the formation of amyloid plaques is a key goal for researchers, offering hope in the fight against Alzheimer's. Inside neurons, tau proteins normally stabilize the cell's internal transport system. In Alzheimer's, tau becomes hyperphosphorylated, detaches from microtubules and clumps into toxic tangles. These neurofibrillary tangles disrupt the cell's structure and block nutrient flow, crippling the neuron. Unlike amyloid plaques outside cells, tau tangles form inside, directly leading to cell death. As neurons die, tangled tau can spread to healthy cells, worsening the disease. The spread of tau tangles closely matches the progression of Alzheimer's symptoms. Many scientists believe tau pathology is the main driver of neurodegeneration and cognitive decline. Preventing tau tangles is a major research focus in the fight against Alzheimer's. The brain's immune cells, microglia, and astrocytes respond to plaques and tangles by triggering inflammation. In Alzheimer's, this response becomes chronic, causing more harm than good. Overactive immune cells release toxic chemicals, damaging neurons and accelerating disease. This self-perpetuating inflammation destroys synapses, the connections vital for memory and learning. As synapses and neurons die, the brain shrinks, especially in memory-related areas. The loss of these connections leads to the hallmark symptoms of Alzheimer's: memory loss, confusion, and personality changes. Damage spreads from specific regions to the whole brain, resulting in total cognitive decline. Understanding this destructive cascade is key to developing effective therapies. Halting inflammation and protecting synapses are crucial goals in Alzheimer's research. Lithium targets a key enzyme, GSK3V, which drives tau hyperphosphorylation and amyloid-beta production in Alzheimer's. By inhibiting GSK3B, lithium helps keep tau proteins stable and reduces toxic tangle formation. Lithium also lowers amyloid-beta generation, tackling both major Alzheimer's pathologies at once. This dual action makes lithium a unique candidate for prevention. Additionally, lithium boosts autophagy, the brain's cleanup process, helping clear existing plaques and tangles. This combination of blocking production and enhancing clearance could powerfully disrupt Alzheimer's progression. Unlike many drugs, lithium addresses multiple disease mechanisms simultaneously. Its broad effects offer hope for a more comprehensive approach to prevention. Lithium's anti-inflammatory properties help protect the brain from chronic damage. It calms overactive microglia and astrocytes, reducing the release of harmful inflammatory chemicals. By lowering pro-inflammatory cytokines, lithium breaks the cycle of inflammation and neuronal injury. This creates a healthier environment for neurons, supporting their survival. Lithium also reduces oxidative stress, further shielding brain cells from damage. Some studies suggest it boosts the brain's antioxidant defenses as well. By fighting inflammation and oxidative stress, lithium preserves cognitive function. Its multifaceted approach makes it a promising tool against Alzheimer's. Lithium doesn't just defend against damage. It also promotes brain repair and resilience. It increases BDNF, a molecule that supports neuron growth and new synapse formation. This boosts neuroplasticity, helping the brain adapt and maintain function despite disease. Lithium may even stimulate neurogenesis, creating new neurons in memory-critical regions, like the hippocampus. These effects help build cognitive reserve, allowing the brain to better withstand Alzheimer's pathology. By protecting existing neurons and encouraging new growth, lithium acts as a comprehensive neuroprotective agent. It supports the brain's natural repair mechanisms, not just slowing decline, but fostering recovery. This dual action offers hope for maintaining brain health longer. Animal and lab studies have shown lithium reduces amyloid plaques and tau tangles in Alzheimer's models. Treated mice display fewer plaques and tangles and perform better on memory tests. Lithium's inhibition of GSK3B translates to real reductions in disease pathology. These findings bridge the gap between theory and biological reality. Improved cognitive performance in animals suggests lithium's benefits go beyond just clearing toxic proteins. This strong preclinical evidence justifies moving to human trials. While animal results aren't always replicated in people, they provide a hopeful foundation for lithium's potential in Alzheimer's prevention. While animal studies are promising, the real question is whether lithium can help people. Early observational research hints at a lower dementia risk for those taking lithium, but these studies have limits. Small clinical trials show encouraging results, yet more evidence is needed. The scientific community agrees. Only large long-term trials will reveal if lithium is truly safe and effective for preventing dementia. If ongoing research confirms lithium's effectiveness, its integration into clinical practice for Alzheimer's prevention would represent a major paradigm shift. The most likely candidates for this therapy would be individuals identified as being at high risk for developing the disease. This could include people with a strong family history of Alzheimer's, those who carry specific genetic risk factors like the APOE4 allele, or individuals already diagnosed with mild cognitive impairment. The key principle here would be early intervention. Starting a preventative therapy as early as possible would be crucial to preserving brain health. The goal would be to harness lithium's neuroprotective effects while avoiding side effects. This has led to the exploration of microdosing or low-dosing regimens. These approaches might involve daily doses as low as 300 micrograms to 150 milligrams. The aim is to achieve a therapeutic effect at the cellular level without raising blood concentrations to a point where systemic side effects become a concern. Given the slow, insidious nature of Alzheimer's disease, any preventative treatment with lithium would almost certainly need to be a long-term commitment. This is not a short course of antibiotics. It would be more akin to taking medication for high blood pressure or cholesterol. Identifying the right patient at the right time would be paramount. The future of lithium therapy would likely be tied to advances in diagnostic biomarkers. Imagine a future where a simple blood test or brain scan during a routine checkup could identify the earliest signs of Alzheimer's pathology. Such a test could pinpoint individuals who would benefit most from starting a low-dose lithium regimen long before they experience any cognitive symptoms. This personalized medicine approach would ensure that the treatment is targeted to those who truly need it, maximizing its potential benefit while avoiding unnecessary medication for those at lower risk, heralding a new era of proactive brain health management. Lithium's promise comes with real risks. Even at low doses, it requires careful medical supervision due to its narrow therapeutic index. The main concerns are long-term effects on the kidneys and thyroid. Regular blood tests and monitoring are essential to catch any early signs of trouble. Older adults are especially vulnerable to side effects and drug interactions. The hope is to protect the brain without causing harm elsewhere. It's a delicate balance. In the battle against Alzheimer's, lithium has emerged as a beacon of hope. Once known for stabilizing mood, it's now being reimagined as a defender of brain health. Research shows lithium may help prevent Alzheimer's by protecting the brain and reducing harmful chiarosol. This represents a new horizon in preventative neurology, offering hope for millions and inspiring scientists to look at old medicines in new ways. While the promise of lithium is undeniable, the path forward must be paved with scientific rigor and caution. Early results are encouraging, but only large, long-term trials can prove if low-dose lithium truly helps prevent cognitive decline. We must also carefully monitor safety, especially in older adults, and weigh benefits against risks. Reliable biomarkers will be key for targeting those most likely to benefit. With diligence and precision, we move closer to transforming Alzheimer's care.